In Bolivia, the Public Health and Medical Branches Union has issued a 7-day ultimatum to the authorities to address its demands for biosecurity and health and social measures to protect its members. Our correspondent Freddy Morales has the story.
6 months after the outbreak of the coronavirus epidemic in the country, the number of dead doctors is huge, and the damages in this sector are multiple, both in urban and rural areas.
Our numbers are dropping, our doctors are dying, we do not have good hospitals in the rural area. There is no equipment and no human resources either.
Sarina is a doctor like her father, who was an emergency director at the General Hospital and died due to the coronavirus.
They are not included within the general labor law. When a doctor dies, the family is left with nothing. I put myself in the shoes of those children who are in training in college or at university, who will no longer have the support of the doctor who has died.
In the midst of the pandemic, third-level state hospitals in the Miraflores complex have remained closed for nearly 3 months. They neither attend patients in their specialties nor treat patients with COVID-19 due to a lack of sanitation, personnel, budget and materials.
The thorax hospital has not been able to open until today because of all the casualties and deaths it has presented. The same thing is happening at the Hospital of Clinics, the same situation at the gastroenterological. We can summarize that the strongest instance of third level, La Paz, has today is working at 10 or 15%. It is a desperate situation. We cannot imagine what diabetic patients are doing, hypertensive patients, patients with cancer, where they are going, as they can't go to where they were treated before anymore.
6 months after the pandemic was detected in the country, this sector maintains the same demands: functioning health insurance, the provision of biosecurity equipment, new health workers to replace those who died or became ill, and inclusion in the general labor law.
The political powers of the country are fighting for the presidency. They are in a frenetic electoral campaign to gain a space as senator or deputy, but they have totally forgotten this is a poor nation that needs help and that the health system today is buried in complete poverty.
The Public Health Medical Branches Union has estimated that in La Paz alone, about 100 of its members have died, 60 of whom were doctors. It has issued a 7-day ultimatum for its demands to be addressed.